This episode is brought to you in lieu of our upcoming 15th Masterclass.
Hello, everyone. I'm Dr. Hongyan Huang, the chair of SIG and the Matrix Implantation as well. As we know in the field of reproductive medicine, the words we least want to encounter, yet which most often plunging both doctors and patients into silence in the clinics are recurrent implantation failure, commonly known as a RIF. So this is a topic we were discussing today in Aspire 15 Masterclass, recurrent implantation failure in Bangkok and Thailand. Then up to date, even with the most advanced microscopes and the most precise genetic screening, risk remains an insurmountable world, not only a significant nightmare for patients, but also the biggest challenge facing clinicians. So why with such advanced technology today, does RIF still leave us helpless? The crux of these problems lie in the multifactorial natures. So the implantation is like the precise docking of a seed and a soul. So in the past, we thought that even with the implantation of newborn embryos screened by PGT-A, a certain percentage of patients still cannot conceive. So is this due to insufficient sensitivity in embryo screening tools, or is our understanding of the endometrial soil too one-sided? So when faced with these unexplained failures in the clinics, how shall we revise our clinical diagnostic approach? This is precisely the mystery that the 15 Aspire Masterclass aim to unravel. So next I will invite Dr. Somjit Manipal-Privar, the chair of the 15 Masterclass, to give you a brief introduction to the exciting program of this masterclass. Subject, please.
All right. Thank you very much, Professor Huang. Let me briefly introduce myself. I'm Dr. Somjet Manipanvirat. I am a medical director at Jetanin Hospital in Bangkok, Thailand. I am more than welcome to have everyone to come to our 15th Aspire Master class in Thailand. I think that it will be very interesting that our theme for this masterclass is the recurrent implantation failure from mechanism to management. It will cover everything from the beginning until the end. In the past, we keep blaming on the embryos that because of aneuploidy, that is why they implant. But, in the past 10 years, it has been quite our headache because, in the past, we just blame it on the embryos in which we don't even know if they actually are the real problems or not. But right now, as many practitioners has adopted PGTA into their regular practice, so it's pretty much like we clear out the problem of the embryos. But in reality, even if the embryo itself is defined of having normal euploid chromosomes, it does not always mean implantation because there could be something else like protein productions, energy productions, and so on. Okay, that is why the embryo, even if they had euploid status, they are not competent. In the past, when we select the embryos, we had our algorithms in our mind. We go with the normal chromosome first, then you go with the day 5 before day 6, then you're going to go with the stage of the embryo and then with the grading. That is what we had learned in the past. Okay, but we all know that it is not always true. Many times you give the ranking of number 1, 2, 3, 4, 5, and you fail with the number one, you fail with the number two, you fail number three, but you hit the jackpot with the number four. So it probably just tell us that with the algorithms that we had in our teaching, in our learning in the past may not be accurate. So with more data that we can adopt from the AI, add on to the PGTA, it could be a better way. We may end up select a different embryo compared to what we had in the past algorithms.
Perfect.
Yes.
Yeah.
And after that, I would say that after we select for the right embryo to implant, then we probably had to take a look into the uterus or the house.
Yes.
Am I right? So
Yes.
now, what do you think? It is kind of interesting to do more investigations in terms of evaluation of the housing in the
Yes.
RIF patients.
Yes. Because we have so many advanced technology currently. For example, sonography to assess the entire structure or uterine environment. 3D ultrasound should be another very good tool for that. Then we'll cover that. And don't forget, the cystoscope still plays some role in RIF to evaluate the uterine etiology in RIF management. And the ERA, so about the including the microbiome testing or coronary meningitis, also plays some role in the repeated implantation failure in the base of uterine factor. So we are trying our best to cover this factor and this issue in the endometrial and uterine factors.
Yeah, those are very interesting. I believe that probably if we learn more on the uterus, just like what we learn more on the embryos when we first adopted GTA for our 23 pairs of chromosomes, that we make a big jump in the implantation success. So if we learn more on on the uterus, then probably we can correct uh, uh, the other part, that we can make the implantation get much closer to 100% eventually. Do you think?
Yes, definitely. Yeah, it's correct.
And after we know about the embryos, after we know about the uterus, then I think as practitioners for ourselves and also the audience, there may have quite a few clinical scenarios that they may have to face, like how to manage the patients who had failed euploid embryo implant, what next to be investigated, what next into treated. That is what I think we may be, you know, keen to discuss and to hear and to learn, from
Yes.
our group of experts, right? And
Yes.
also at the end, when you get to the point that you still don't really know what is the problem,
Yeah.
then in some country or in some scenarios, that gestational surrogacy is allowed.
Yeah.
Okay, so probably we may want to discuss about, well, is that the time to consider gestational surrogacy in case of RIF?
I
Okay.
think this is very exciting because to manage a RIP patients, actually most of the controversial points, sometimes they are very critical point for that. So that's we can cover about, for example, how can you grow embryo state cannot implant, and how to treat a service with gestational surrogacy to cover those patients that cannot have conceived by their normal uterus, and how about the how to prepare the endometrium to reach the maximum consumer rate of the patient. I think all these are very critical issues about the controversial in RIF patients.
Yeah. And I believe that when you have patients who have been failing so many times, it is a time that they comes and talk to you about the add-on, in
Mm-hmm.
which I believe that we as an expert has come across the point that we had to discuss with the patients and also to review the scientific literatures and evidence on the benefit of add-on, which include PRP. I believe that it has become more and more commonly used. And
Yeah.
how about the use of the hyaluronic acid in those who had RIF? And what is about the use of GCSF in the intrauterine infusions or the
Yes.
use of GM-CSF supplement in the cultural media for those with
Yeah.
RIF? I would say that it would be very interesting that we
Yes.
had the chance to discuss on this add-on.
Because all these add-on, they probably play some role for that. But actually, it's very difficult to prove the therapy or add-on have some significant effect on the clinically, right? So I think this is I think it's getting popular and more popular for the add-on to try everything to help to try to optimize the pregnant rate or success of RIP patients. So I think we try to touch upon this point, so this add-on to optimize endometrial receptivity in RIP.
Yeah, that I think those are what we can spend so uh, much time debating on that because study has shown benefits probably in the initial reports, but later on when you have more studies, it goes the other way around. So
Sure.
that is something that we need to keep an eye on, and definitely we need to be more analytical in terms of reading the journal and then to interpret and also hear from the other experts about what are their perspective in those studies.
Yeah.
Professor Huang, do you have any experience on the immunologies or the thrombophilia? Would that be something that we should discuss as well?
Yeah, I think the to immunotherapy currently is the most controversial field. I mean, the therapy for that, because the immunotolerance in implantation was so complicated. Some even there are still black box and enigma for that. But we still try to get enroll some expert. They have some really experience to about the immunotherapy, and they really know how was the positive effect and how the negative effect. And the software testing and anticoagulant use, some are very critical for those kinds of limit specified indication for patients. So in this section, we are trying to manipulate strategy and case integration of the immunological and thrombotic factor in RIF patients.
Yeah. And I think also on the endometriosis and the adenomyosis, these are quite common, and
Yes.
we know that they has strong correlations with the infertilities. But we probably will have time to talk about what are their pathophysiologies and what are to manage on those
Yeah.
with endometriosis and
Yeah.
adenomyosis along with RIF. Am I
Yes.
right? And
Yes.
also, some things that probably sounds common like fitness and metabolic treatments in which we know that uh, has an impact on the embryo to grow. So
Yeah.
that could be something that we have to discuss as
Yes.
well. Professor Huang, I know that probably we're gonna have uh, some hands-on workshop as well. Am I right?
Yeah,
Yes.
we have hands-on sessions and
Okay.
we try to establish embryo transfer stimulators to and 3D ultrasound to assess endometrial and uterine factor in RIF patients. So I think it's a hands-on sessions. We just try to like a add-on procedure and program for this fruitful program for of the master class.
That would be quite interesting to
Yeah.
have them hands-on and to have senior uh, staff who can guide or supervise on because embryo transfer for many people they do not really have chance to practice in real person. That could be something that it would be nice that we're gonna have the simulators for them to do, as well as the 3D ultrasound, because the machine is quite common in most examination room nowadays.
We would love to see you in Bangkok this October for 2 days of interactive discussion and practical learning on recurrent implantation failure from mechanism to management. Okay?
I am waiting to receive everyone at the doorstep in Bangkok. Thank you.